Cervical cancer is largely preventable and highly curable when found early, yet it still causes about 660,000 new cases and 350,000 deaths worldwide each year, mostly in low and middle-income countries. Today's video covers what cervical cancer is, how HPV causes it, who is at risk, how screening and vaccinations save lives, treatments that work, and a hopeful action plan anyone can start now. What it is and why it happens. Cervical cancer begins in the cells lining the cervix, most commonly as squamous cell carcinoma and less often as adenocarcinoma, driven primarily by persistent infection with high-risk human papillomavirus, HPV, types, especially 16 and 18. Women living with HIV face a roughly six-fold higher risk, and inequities in vaccination, screening, and treatment access drive the global burden, particularly in sub-Saharan Africa, Central America, and parts of Southeast Asia. Global burden and urgency. Global burden and urgency. Cervical cancer leads female cancer deaths in at least 37 countries, underscoring the life-saving power of vaccination and screening when programs reach communities consistently. Symptoms to watch. Early stages may cause no symptoms. Warning signs include abnormal vaginal bleeding after sex, between periods, or after menopause, unusual discharge, and pelvic pain which warrant prompt evaluation. Because precancer is silent, routine screening is essential even when feeling well. Screening finds changes before cancer develops or when it is most curable. HPV vaccination. WHO supports 1-dose or 2-dose HPV vaccination for girls aged 9 to 14, with 1 or 2 dose schedules also acceptable for 15 to 20. This policy aims to expand coverage and accelerate equity in prevention. Robust evidence shows single-dose schedules can provide high protection comparable to 2 or 3 doses, making rollout simpler and more affordable for health systems. Screening that saves lives. Countries are shifting from Pap cytology to primary HPV testing because HPV tests are more sensitive for detecting precancer. Recommended intervals with HPV testing can be safely longer than cytology intervals. Many programs advise cytology every 3 years in the 20s. Then HPV testing every 5 years from 30 to 69 if negative. Local guidelines vary, so following national recommendations is key for timing and follow. India and LMIC programs. Large-scale screening is feasible using PAP, VIA, VILI, or HPV testing with community outreach, and has been piloted successfully in Indian settings with NGO government partnerships. India currently lacks a single comprehensive national screening program, with VIA recommended for women 30 to 65 at 5-year intervals since 2016. Increasing coverage remains a priority to reduce deaths. Staging overview, FIGO. Cervical cancer is staged from 0 carcinoma in situ through I4 based on tumor size, spread to surrounding tissues, and lymph node or distant organ involvement, guiding treatment choices and prognosis. Early stages confined to the cervix, eye are often curable with surgery or definitive radiation, while locally advanced disease, IB3-IVA, is typically treated with chemoradiation and brachytherapy. Treatment options by stage. Early disease. Options include fertility-sparing surgery, conization, or trachelectomy for select stage EAEB1 cases, and hysterectomy for others, sometimes followed by adjuvant radiation depending on risk factors. Locally advanced. Concurrent chemoradiation with platinum agents plus brachytherapy is standard and improves survival. Modern IMRT techniques help limit toxicity during external beam radiation. Recurrent metastatic, systemic therapy, targeted agents, immunotherapy, and palliative radiation surgery may be considered in multidisciplinary care tailored to prior treatments and sites of disease. Why HPV testing intervals can be longer. Evidence shows that after a negative HPV test, the risk of precancer remains very low for years, supporting 5-year intervals, which may be even safer than 3-year cytology intervals in terms of precancer detection risk. Longer intervals reduce overtesting while maintaining safety, allowing programs to focus resources on reaching more people with initial and follow-up screens. Who's at higher risk? Risk is elevated with persistent high-risk HPV, early sexual activity or multiple partners, smoking, long-term oral contraceptive use, high parity, HIV, and immunosuppression, among others. Regular vaccination, screening, and smoking cessation significantly lower risk, with special attention recommended for immunocompromised individuals and those with limited access to care. Actionable screening plan. Start screening as recommended by national guidance. For many programs, this means cytology from mid-20s, then HPV testing every 5 years from age 30 to 69 if negative, with earlier or more frequent screening for high-risk groups. If a test is abnormal, ensure follow-up for colposcopy and treatment of precancerous lesions. Timely treatment prevents progression and saves fertility in many cases. Lifestyle and supportive care. Vaccination, screening, and not smoking are the big three. Maintaining overall health with nutrition, physical activity, and STI prevention supports immune defenses against persistent HPV. Survivorship includes managing treatment effects, sexual health, and emotional well-being. Care teams can provide pelvic floor, pain, and psychosocial support services that improve quality of life. Practical 5-step community checklist. Check vaccine status for eligible kids and teens and schedule catch-up when allowed by local policy. Set a screening reminder today. After a negative HPV test, mark the next screen in 5 years per guideline. And don't skip follow-up after abnormal results. Encourage smoke-free homes, STI protection, and prompt care for bleeding or discharge symptoms to reduce risk and detect issues early. Cervical cancer is a cancer the world can eliminate with vaccination. Screening and timely treatment, every completed dose and every completed screen moves families toward a future free of this disease. Prevention is power. Shots and screens save queens. 1 dose, 1 screen, a lifetime of protection. From fear to fearless, step by step. If this helped, like, share, and subscribe to spread practical hope someone's life might change with this information today.